on the floor, it goes fast. But I got to go through the infections caused by the bugs. So get ready. Most of it is just buzzwords, folks. It goes very quickly. So gram-positive, first group, Staphylococcus, gram-positive cocci clusters. I told you they always give you the culture results. I give them a point just based on that alone. Because it's a unique description. Nobody else has that description. That means I'm not confused about what family we're talking about. Before I worry about Bacitracin and Aptochin, there it is. This is the best clue right here. The description, because they always give it. Okay, Staphylococcus, gram-positive cocci clusters. Now here's the family members. All right, gram stain we already talked about, but here's the family members and how to divide. This is if you want to go through and memorize. I don't do all that, but here's how I do it. Staphylococcus family, there are 3 guys, and all 3 are catalase positive. That's how you separate them from strep. That's one of their favorite questions. How do you separate staph family from strep family? Well, one is catalase positive, the other one's catalase negative. So real easy. Okay. And then any other enzyme you name is under Staph aureus. Take your pick. The one they like is coagulase. Yeah. But I'm not trying to, I don't care what enzyme you pick. Every other enzyme is Staph aureus. Okay. Just keep it that way. What about pigments? Staph aureus. Gold pigment. AUR. Even though I misspelled it here. There's a U missing. All right. Staph aureus. Gold, AUR for gold. So that's how I remember it. Just like Pseudomonas, all original AUR is gold. Epidermis, white pigment. Epidermis is your skin, so ashy white skin. That's how I remember it. So you can separate the members by the pigment. Gold pigment, aureus. White pigment, epidermis. No pigment, saprophyticus. See? That way you're clicking and moving, folks. Clicking and moving. Okay? Any questions on that? All right, now let me give you the enzymes that Staph aureus has. Yeah, I'll do it in white. First one, beta-lactamase. You love this picture right here. This is a beta-lactam ring. Does everybody see that looks like a house attached to a garage? Yeah, all you gotta do is open up the garage to get into the house. That's the bond broken by that enzyme. And I can't even tell you how many times I've gotten a point for it. That's why I share it in class now. Or else I don't bother. Okay? But they love asking this question. Okay? All right, beta-lactamase. All right, is how Staph aureus is resistant to a lot of different antibiotics, which is why the ones who cover Staph aureus, notice I always mention including Staph aureus at the end, because there's a whole lot of gram-positive coverage that cannot cover Staph aureus. You got to know who actually can, because Staph aureus, catalase positive, remember your first wave of killing cannot even touch it. That means he's more likely to kill you if you start the wrong antibiotic, and your patient is dead by the next day. So beta-lactamase, okay? Then there's coagulase, and staphylokinase. This is how Staph aureus eats through blood clots. Coagulum, clot. Okay? Eats through blood clots and kills a burn patient. Because when you get burned, your blood curdles and clots up. Staph aureus still eats through that clot and kills the patient anyway. Staph aureus, #1 cause of death in the first week after a burn for that reason. And that's how I link myself. Anyway, the way I remember all these enzymes, folks, I link it to a disease that he causes. That's how I remember the list. That means if I know the enzyme, I know the disease. If I know the disease, I can trace it back to an enzyme. Okay? That's just my way of remembering it. It makes it much easier. So the clots. Another thing associated with clot is acute endocarditis, IV drug abusers. There's a little clot of blood at the tip of the needle when it's being used because, sticks in it, there's blood. It gets stuck there. That means the very next person who uses that same needle is going to push that blood clot right into their vein. And what's it going to do? Float to the trochanteric valve and get stuck. That's how you get acute endocarditis. And that's why IV drug abuse is the #1 risk factor for it. So acute endocarditis is all tied to coagulase and staphylokinase. All right. Then there's enterotoxin. This is Staph aureus food poisoning. Notice preformed toxin. That means you get symptoms within 8 hours of ingestion. Staph aureus, Bacillus, and Clostridium, the only three with preformed toxin. So anytime you get ill, like within minutes or hours after a meal, you already know it's only down to 3 guys that can do that. All right, so enterotoxin, Staph aureus gastritis associated with dairy products. Dairy products. And symptoms very quickly. Then there's elastase. We've talked about before. This is how it causes bullous stuff, like bullous emphysema, bullous impetigo. If you remember, elastase cuts to the right of what amino acids? Jess. Elastase cuts to the right of what amino acids? Which one? Glycine, alanine, and serine. Remember, Gastolase was the new one I gave you. Okay, Gastolase. So elastase is what he uses to eat through the elastic fibers of your lung and chest wall. That's how you get a bullous emphysema. You get bullae in the lungs. They call them pneumatoceles. And after a while, they pop. That's how you get pneumothorax after the Staph aureus infection. And Staph aureus loves to attack after the flu. Remember, we said that before. That's what kills the 10 to 20,000 elder people every year. Is the Staph aureus, not the flu that kills them. It's the Staph aureus that comes after that. Yes, sir. Why does the Staph aureus like the flu? Because the virus produces 2 things that Staph aureus needs. Remember that V and X supplement? Yeah, the heme and the NAD plus. Yes. Flu bug makes both of those, and Staph aureus needs both of those. And that's why he comes in after the flu and destroy and kill somebody. Any questions on that? Next one, lipase. This is how back Staph aureus eats through lipid. That's how you get folliculitis. That's lipid. Umphalitis, lipid. Paniculitis, lipid. All right, erysipelas, subcutaneous fat, lipid. See, all I do is just connect it to infections where he caused it. I said, oh, now I see how he causes all this. All right, so lipase, lecithinase. This is why Staph aureus can eat through connective tissue. And the same thing with hyaluronic acid, so hyaluronidase. This is why Staph aureus can, when you get infected with Staph aureus, no, he spreads in every direction. That's because of these 2 enzymes. Eat right through connective tissue. Where strep had to find a lymphatic channel. Remember the red line leaving? Yeah, totally different. This guy can eat through anything. Doesn't bother him at all. This is also why Staph aureus is the first bacteria in every abscess. Yeah, because he eats a hole into anything. And then it makes it easy for other guys to come in. Any questions so far? Yes, sir. Septic arthritis is coming up. That's collagenase. Collagenase eats through collagen. Remember, there's 4 types of collagen. Scab was the mnemonic I gave you. They found a 5th collagen now, but that's not on your exam yet. But collagenase eats through collagen. Where do I find type 1 collagen? Angie. Skin. That's why Staph aureus most common cause of skin infections. Where do I find type 2 collagen? Mitchell. Connective tissue. Let me go around your body and mess up connective tissue. This is why Staph aureus, #1 cause of fasciitis. That's connective tissue. And compartment syndrome is your clue. #1 cause of osteomyelitis. That's connective tissue. Except in sickle cell patients, then it's what bud? Mayha. Osteomyelitis in sickle cell patient. What's the most common bud? It's not Staph aureus. I gave you a different one. Now strep, Montessori. Which one? Not epidermidis. Andres? Sandra. And Reed. Okay, who remembers? All right.
Strep pyogen.
Who's talking online? Who's all right,
Mabel.
Paul, do you know the bug?
Strep pyogen.
It's
Oh, Mabel, wait till I wait till I call your name.
Strep.
No, Mabel, wait till I call your name. All right, Paul, what's the bug?
I think it's salmonella.
is salmonella. That's the only time salmonella is number one. The Staph aureus every other time. Okay, so that's osteomyelitis. Update on osteomyelitis. They want a surgical culture. That means you ask the surgeon to biopsy that bone and find out what bug it is. Because before we were swabbing and all that stuff, we were wrong majority of times. I mean, you're just swabbing the skin is what they're finding. So they said no more of that. They want surgery. Go in there, bite a little piece of skin. Now we know exactly what bug it is there. Okay. But just so you know who you're covering. Yes, sir. Yeah, MRI. Yeah, if you do an X-ray before 10 days, you're not gonna see a thing. Yeah, then after 10 days, you can find on X-ray, but MRI is the best because you can see even a little crack and pus building up already. Okay. All right, so that's type 2 collagen, connective tissue. So septic arthritis. Anybody who has a fever and a joint pain gets tapped today. Because Staph aureus will digest your joint by tomorrow. And that's called malpractice. So they'll try to fool you with somebody who has rheumatoid and lupus, make it sound like it's just a rheumatoid, doesn't matter. You come with a fever and a tender joint, you're getting tapped today. No orthopedic surgeon gets mad at you when you say, I got a fever and a tender joint. Oh, I'll be right there. Because he knows, but we both get sued if he doesn't tap it today. Okay? Because when it's Staph aureus, you got to get in there, you see pus. You got to clean it out, spray antibiotic in there to kill this thing, or else it would have been digested by tomorrow. Okay? And now all of a sudden, now the person's joint is completely gone. All right, so collagenase, type 2, connective tissue. What other places? Tendinitis, bacterial tendinitis, bacterial tracheitis. When the nurse says, I'm suctioning all this pus out of his tube, that's tracheitis, that's Staph aureus. Okay. Bacterial parotitis, parotid gland, that's connective tissue. So when you intubate the patient, and then all of a sudden you rub their skin and then Staph aureus goes in. So they love to ask you, how did he pick it up? It's usually from intubation, not from the blood. Okay. So collagenase ties me to a lot of infections. All right. Where do I find type 3? Abigail, type 3 collagen, where am I going to find it? Type 3 collagen, where am I going to find it? Mabel?
It's in the blood, sir.
It's not in the blood. Mabel.
Blood vessel.
Thank you. There's a difference between blood and blood vessel now. You don't want to mistakenly give away the
Okay.
point. So it's blood
Yeah.
vessel. So vasculitis due to Staph aureus, nothing unique. You still see schistocytes like anybody else. All right. Type 4. Where am I going to find it, Amy? Basement membrane. That means with Staph aureus, you're more likely to bleed into your eye. What's it called? There's a term for that. Vitreous hemorrhage. When they have an infection, you can bleed into the aorta. You can bleed into your lungs. You can bleed into your kidney. All right. Those are just some specialized basement membranes, but it can bleed anywhere. All right. Any questions so far? All right. Then there's 2 super toxins. There's one called toxic shock syndrome toxin and staph scarlet skin syndrome toxin. And let me see, that one works with exfoliatin. These are called super toxins, not exfoliatin, the other 2. It means that they were so big, Miguel, that your macrophages could not process them. So they had to fall across several different T lymphocytes to be processed. But let's say they fall across 3 T lymphocytes. That means you're going to get 3 times the response. And that's why these are 2 very deadly infections. Gram-positive infections are not usually deadly, but these 2 are because of the way they get processed. The other tricky thing is they'll ask you, what cellular infiltrate you expect to see? It's not neutrophils and B cells as you would expect because they're bacteria. You need the T cells and macrophages to process this thing. All right, especially the T cells. So they love asking that for that reason. They're hoping you forget and just pick B cells and neutrophils like you would for any bacteria. All right, so first one, toxic shock syndrome toxin is usually around her menses. Remember, it has to do with tampons that were left in. However, what we're finding out now is that on the internet, some mom told a bunch of other mothers, if you want to stop your child's nosebleed, stick a tampon in there. The tampon is absorbing the blood, right? Yeah, good advice. It does work. However, they left it in. Folks, now I'm seeing that question show up on UWorld. That means it's on your exam now. Because we never expect you to see toxic shock in children. But we're now seeing it. There's so many case reports now and literature, so they want you to make sure you know about it. Okay? So the other one, boxer. They put a gauze in their nose because they were bleeding from their nose, but they leave the gauze in there till the next day. So I've seen a couple of questions. They say he was a boxer and he comes in sick and all that, and then you notice there's a piece of gauze still in his nose. That's where it's coming from. Okay? So what do we see? It's called toxic shock. They come in shock. I mean, it's overwhelming shock. Number two, they come in looking toxic. That's why they call it toxic shock. Number three, they mentioned something about menses or, nosebleed or a fighter. Then I know that's what they want. Okay? And then they have a rash, red rash on the palms and soles. So it's one of our palms and soles rashes. Toxic shock. Staph scarlet skin syndrome, red rash all over the body, including the palms and soles. First clue. And then the second clue, positive Nikolsky sign. Ashley, who else has a Nikolsky sign? No. Toxic epidermal necrolysis, TEN, and then pemphigus vulgaris. That's the only three. All right. And that works with exfoliant. Notice the word exfoliant, right? It's an enzyme, but exfoliant means to peel off. That's because your skin will peel. That's the equivalent of a 3rd-degree burn. If that's a 3rd-degree burn, tell me about the Parkland formula for figuring out your deficit, Leslie, and then I'll answer your question.
What was the question again?
Give me the Parkland formula for fluid deficit after a burn.
Okay, it's gonna be 4 cc plus, I don't remember. Just
Okay, 4 cc's of normal saline times your weight in kilograms times percent burned area not to exceed 50%. All right, make sure you know it. And then you give half over the first 8 hours, the second half over the next 16 hours. So by 24 hours, they're fully hydrated. Remember, you also give their maintenance. Staph epidermidis, let me just finish these two. Staph epidermidis, white pigment.
Doctor, I have a question.
Okay, what's your question?
Psoriasis also have Nikolsky sign?
Psoriasis?
Yeah.
No, psoriasis doesn't have a Nikolsky sign.
Only
Yeah,
TNN
only pemphigus vulgaris.
and TNN?
And TEN, yes. Yeah, Mabel, questions?
Yes, sir. Please, you said Nikolsky sign. Please, can you spell it for me, please, sir?
Oh my God, Mabel, I've given you this name before. All right, man, I don't know why you guys want to write this down 10 times. Nikolsky sign.
Okay, Nicholas. Okay.
Then you could have just ridiculous without asking me.
So you also said that P. vulgaris is in P. vulgaris and one other stuff,
Yeah,
right?
pemphigus vulgaris and TEN, severe allergic reaction.
Okay, thank you, sir.
All right, staph epidermidis causes 3 infections I gave you. Remember central line infections? Pull the line out, culture the tip, there's a biofilm on top of it. All right, ventriculoperitoneal shunts, pull out the shunt, culture the tip, there's a biofilm on top of that. And then metallic joints. Best drug against staph epidermidis, Kathleen? What? Vancomycin is the only one we're using. It's the best coverage. Okay, then if you have vancomycin resistance, what do you do, Angeline? You have vancomycin resistance. What do you do next? Next up was fine. Next thing you do next, Abby. Linezolid, still not the best answer. Jess, what are you going to do next? What? Desensitizer? No. Anim. Isolate the patient. If you forget to isolate, you're not going to get a point. Isolate, negative pressure ventilation, then linezolid. But it's 3 steps, folks. I'm telling you, be careful. So easy to go right to that drug of choice because you read it out of a book. You don't realize there was 2 other steps that were more important than that. All right, anyway, that's staph epidermidis. Staph epidermidis, postcoital UTI. This is common in little girls between the age of 5 and 10. Why? Because they like to stick things into their vagina. Now, we don't call that masturbation, just so you don't mistakenly pick that answer. That ain't it. All right. A little girl, 5 years old, don't even know what masturbation is. All right. It's called self-play. They play with themselves all the time. Okay. And then they leave a bead in there, a little foam in it. Come on. Anytime you see a 5 to 10-year-old girl with a lot of vaginal discharge, that's not abuse. Abuse is always answer A. That's not abuse. There's a foreign body in there. Okay. And you need to get it out. Okay. Or else they're going to get a bad infection from it. Yes. Huh? E. coli is from the rectum. They pushed it in from their skin. They didn't touch E. coli. Yeah, this is from the skin. So saprophyticus, 5 to 10-year-old girls. Everybody understand? It's also common in 18 to 24-year-old women. Why is that? Because they still stick things inside themselves. Except now they're called boyfriends and husbands. And so that's why they call it postcoital. Remember I told you something, the skin of the penis, and the first couple of times they have sex, it introduces the bacteria into her vagina, she gets infection, and then it goes away after a while. So you may only have to treat it a couple of times and then it becomes her normal flora. Question. No, toxic shock is only if you stick a tampon in there. Yeah, little 5 to 10-year-old girls don't play with tampons, so we don't see that. But watch out for toxic shock. We see it a lot in children now. You know, the nosebleed. I just saw it a few months ago. I was doing a question with somebody. All right, so I think that's yeah, good place to stop. 5 o'clock on the nose. We'll take it from there in the morning.